Hi everyone, my name is Dr. Jeanelle de Gruchy. I am Director of Public Health in Tameside, which is a local authority area in Greater Manchester in the northwest of England. I'm also President of the Association of Directors of Public Health, which is an organisation that represents directors of public health across the United Kingdom. Now, for those of you who aren't familiar with the Director of Public Health in the UK, we are senior officers in local areas providing leadership and expertise for our local communities in all things public health. In many ways, our role is like the Chief Medical Officer, Chris Whitty, has at a national level, but for our own local areas and communities. My job as President of the ADPH is to advocate on behalf of all directors of public health and provide a collective voice for the public health system. It's been a year like no other, really, and directors of public health have had to step up to protect their local communities the best way they can in this terrible pandemic. Despite deep funding cuts to our public health budgets over the last decade, and incredibly, this year's spending review effectively cut our budgets yet again. We have played a critical part in our country's response to COVID-19. Part of the nature of our role is to just get on with the job. We're very pragmatic and we need to make things work for our local communities. We work diplomatically to resolve any issues or disputes, and we use our expertise to enable people to make good decisions, or the least worst decisions in the circumstances over the last year. Directors of public health have played a key role in stitching together the different elements of the pandemic response. Early on, PPE was a big issue. And then over the last year, testing, contact tracing, managing outbreaks in our care homes or schools or other settings, and more recently, supporting equitable uptake of the vaccine. Through all this, we provide that kind of system leadership to bring it all together to work effectively on the ground in our local areas. And through the work that we've done, our reputation has definitely grown and given us a louder voice on the national stage for local, and that real recognition of local public health and its importance. We can certainly be confident and proud as a public health community that we've raised that profile, risen to the challenge of the last year, have protected our communities as best as we could. We've strengthened our relationships, and we've ensured that local experience and knowledge is much more understood, respected, and championed within local government, within national government. COVID-19 has also shown the value of local public health within our councils or our local NHS, and really the important potential of a team of team approach with other public services, with the third sector, with the charities working collaboratively on everything. And we have certainly wanted that those good relationships at a local level and the way we've worked to continue. I also want to mention and pay tribute to our Public Health England colleagues, and we definitely work very closely with them. But now, during the pandemic, there is a reform of the UK public health system going on. It's underway. Directors of public health in local government in England will be constructive partners to ensure the transition doesn't disrupt our COVID response, or indeed the other health protection and health improvement work that Public Health England currently do provide leadership on. So the establishment of the new UK Health Security Agency and the expanded remit of the Chief Medical Officer in the new Office of Health Promotion, does offer an opportunity to set an ambitious public health agenda as we start to exit the worst of the pandemic in the UK. And we look forward to working even more closely with Dr. Jenny Harries and Prof. Chris Whitsey, who will be leading these directorates and organisations respectively. So we need to rise even higher over the next year to the challenge of what comes next. While continuing to contain COVID, we also need to embed the lessons we have learned over the last year, making the case for ensuring an understanding of local communities and the need for a local response is at the heart of our new public health system. And we need to reinforce, make the case that funding is crucial to enable this to happen, and to happen efficiently and effectively, to tackle the unacceptable levels of inequality and to create healthy places for all. Because COVID has also shone a very bright light on the inequality scarring modern Britain. We have seen the poorest and the most vulnerable in our society, including those in our care homes or those from Black minority ethnic communities or our more deprived communities, that they've been most at risk and have experienced the most harm. Recovery can't just be about going back to normal. We need to think about the kind of society and economy we want to live in the future. Government policy that fundamentally prevents ill health and creates health, that aims to improve the social determinants of health through investing in good housing, early years education and services, and meet the needs of our local communities, that really is crucial. One thing we can now say for sure after this pandemic is that public health must be local by default, with a system that is well resourced nationally, regionally, and most importantly, locally.